Hello, how's everybody doing today? So it's been a long time since I was able to post a video. I've just been getting hammered with school. I've been just extremely busy with graduate school, and then I'm also running a healthcare business. I'm one of the owners of a healthcare company that I can talk about later in a later video. But that has kept me busy seeing patients and being in the office and being on call, and then combined with the graduate work has kept me extremely busy. But a quick update, I don't think I've made a video since I was in semester 3, I want to say. I am now in semester 4 of 8, and I am in either my 5th or 6th week of the semester. So a little update in my semester 3, I got an A and a B. I was in a health assessment class and then a roles and issues for advanced practice class, which basically talks about your role as a provider. And so now I'm in a advanced practice procedures class, which we go over radiology such as x-rays. We go over different procedures like paracentesis, intubations, ventilator settings, a lot of things that as an acute care nurse practitioner I could do in clinicals or when I'm out of school. And then the other class is just a care of adult populations class where you go over each system and just learning more in depth treatments and learn how to start to formulate a differential diagnosis and things like that. So as always, people always ask me, what books that we currently use or what study resources I use. And I brought 2 study resources that I'm currently using. In my advanced practice or in my procedure class, we have to go over EKGs. And, you think you know EKGs because you do it on the BSN level, but this is a little different. It's more nuanced. You have to know, formulate a little bit more of a differential diagnosis based on the EKG and based on what they give you about the patient, what symptoms they're having, different things like that. Anyway, so a great book, my friend who's a paramedic let me borrow this, but this is a great book, honestly, even for undergraduate, but definitely for nurse practitioner students, and really any student that's trying to learn EKGs. It's probably the best book I've seen. Rapid interpretation of EKGs. It has a lot of pictures. As y'all know, I love some pictures. I love my little Blue's Clues type pictures, so I can learn it a little easier. Anyway, it's a great book, easy to carry around when my son's having baseball practice. I'm sitting there like a big nerd reading it, trying to watch him at the same time. But this is a great book for learning EKGs. Another great book that's not required for my program, but I kept seeing online videos about it, and there's actually a part A and a part B, and it's a pretty thick book, but it's called PANCE Prep Pearls. A lot of people can ask me, well, first of all, what is that name? What does that mean? So the PANCE is actually the certification test that PAs take after PA school. So you're like, well, you're in a nurse practitioner program. Why would you read a book for board exams for PAs? But again, it's the same information that you're learning pretty much for the most part. And it's broken down in a very easy format. It breaks down each disease, like for example, like this page alone is just Huntington's disease. And what it does is it goes over how to diagnose Huntington's, for example. What imaging can you get? What labs? What are the clinical manifestations? And then what's the management? And it's just simply broken down in very easy terms. A lot of this stuff I've been making into like flashcards through Osmosis, which uses Anki. I still use a lot of the same online resources. I'm refining my studying techniques and what I use to study to make it more effective, instead of trying to study longer or just read through textbooks. Because I also have a huge primary care textbook that we do have to read. You're like, well, you're in an acute care program. Why are you reading a primary care book? Well, if you want to work as a hospitalist or a lot of different jobs, it's a great foundation. I also have to take a chronic care class, because if you think about it, if you're working in a hospitalist role, there are acute exacerbations of chronic issues. So it's very important to have that foundation, that primary care foundation. And then also we have an advanced practice book for older adults. All of these books, there's a link in the description box for all these books where you can go straight to the book and order it through Amazon. The PANCE Prep Pearls, like I said, very cheap. I think each edition, well, I think total I spent either $50 or $70, somewhere between like $50 to $70 for both editions of the book. You can buy them separate or as a package. And then same thing with the other school books and the EKG book. They're all in the description down below. But as I was saying, those books have been phenomenal as well. But I'm still using a lot of the same online apps, or I can use the apps on my phone or on my laptop. Picmonic, I talk about Picmonic all the time because it has a lot of colorful pictures. Again, love my colorful pictures. Very easy format, a lot of quiz questions. So I'm still using Picmonic probably every single day, doing the daily quiz questions. And then the other resource that I use all the time is Osmosis. Osmosis is also similar to Picmonic in the sense of it has very colorful videos and images that they use to help you really get down what they're talking about. And the thing about Osmosis, I like it incorporates the Anki flashcards. You hear people talk about Anki flashcards all the time for spaced repetition. So it incorporates it into Osmosis. You can make your own, or they have flashcards already there that you can just use. They have study schedules you can use. They have board type questions. I have the MD version, so the board questions are very difficult, but I'm learning a lot. I'm watching the videos, doing the board questions, doing the flashcards. So both of those, Picmonic and Osmosis, have been extremely helpful. A couple of other ones that I use, but not as much, but I really like a lot. OnlineMedEd is the doctor that does the lecture videos. Amazing. He describes everything in great detail. He's got a whiteboard behind him. He's writing things, and it just, for some reason, his videos just really stick. So that's OnlineMedEd. And the other one I'm using is USMLE-Rx, which they make several different products that you can buy. That they have textbooks and everything, but they have something called USMLE-Rx Bricks. The USMLE, actually, I have USMLE flashcards here that I use. This is actually again the step 1, step 2, step 3. This is the test that MDs take to be certified as an MD. So the questions are very difficult, but on USMLE-Rx Bricks, it's kind of like PANCE Prep Pearls, where they'll break down a disease. You can look up a specific one, a specific thing like Huntington's disease, for example, and you can read this brick, is what they call it, of information about it. And at the end, it's got questions that you can answer. It's just the way that they break it down. It's more in depth, but if you really need to learn something, it's a great resource. But anyway, so that's kind of my update on semester number 4. So far, it's just been super hectic, super busy. I'm reading all the time. I'm studying all the time. Flashcards all the time. But if you have any questions, give me a comment and ask me, if you have specific questions about study materials, things like that, that I can help you with. And anyway, hopefully I can start uploading some more videos. I'm getting a little bit more time. But everybody, have a great day. And thank you for watching.